What up, fellas? It's Ty. Welcome back to the channel. We discuss all things prostate and prostate cancer related. As I always say, if you're new here, welcome to you. And if you've been here, watched the video, or maybe even liked and subscribed, I appreciate you and welcome back to you. So listen, I want to talk today about something that you need to do as soon as possible. And that is, you need to find a very good primary care physician, because your primary care physician is going to be responsible for your care once your radical prostatectomy has been done. Now, how does that work? I don't know if I'm lucky, but my doctors are working so that I'm still 3 months, or I'm going every 3 months. I'm at 6 months probably after my next visit. But one of the things that's happening is, in between that time frame, I'm going to see my primary care physician. My primary care physician is making sure that before that time frame is up, that in between it, he knows what my numbers are. And he's looking at those numbers and comparing them so what happens is that they do my blood work. It doesn't do my PSA because I don't have prostate anymore. But he runs that, and then what happens is that when my urologist or surgeon runs those numbers a half a month later, then they can compare to see whether or not anything is going on, anything has changed. And then, of course, when I go that later time, then my primary care physician has 2 additional sets in addition to the newest one to run these numbers off of. So you need to find a good primary care physician. How do you do that? Well, you could ask around and try to find one that most people like. You can look in the newspaper, or we have like the 10 best doctors in our area. Listen, sometimes you have to wait for an appointment with these people, but set it up. Go see the best person, right? You want the best care possible. So go see the best person. Don't go to these doc in the boxes or anything. You want somebody that understands what's going on with you, what your medical history is, so that there is an encompassing real world understanding of who you are as a person, who you are in regards to, or where you are in regards to your health, and how it is to get you to the best situation. So if you need erectile dysfunction medicine, or if you need a refill on something, your primary care physician is doing that. Your surgeon and urologist is not going to do that. I know that my surgeon's in surgery all day on Thursday. So if I need to reach him, I can't. That's what your primary care physician is for. Now, a pro tip: make sure that your primary care physician has everything on site, meaning that you can get your blood drawn on site, and that you can, anything else that they want you to do as far as labs is concerned, you can do that right there on site. You do not want a primary care physician as a man that you have to go to, and then the labs are somewhere else. It's too much stuff that can happen between them giving you the order to go get the labs done and you getting in your vehicle and going over there and getting that done. It's just too much stuff that can happen. So I don't want you to get into the point where you're saying, oh man, no. Find one that has that, so that you can get there and get all of that stuff done at the same time. All right? So find your primary care physician. I always find that if you ask a woman, they'll find the best doctors for you, or they'll know the best doctors. Because if you ask another guy, most of y'all don't have primary care physician. I mean, we're keeping it honest. You probably don't have a primary care physician that you see every year for your physical and test and all of those things. But I'm telling you, if you don't have one, you're not getting the care that you need, because just going those 3 months and doing that is not a care plan. At least I don't think so. But like, again, I paid $40 to go see him, and so that I could get everything straight. So I hope this finds you well. Hope this information is helpful. Peace and blessings, man.